Silence can be deadly, especially when it comes to men's health. Prostate cancer, a silent threat, infiltrates the lives of millions of men annually, often without fanfare until it is too late. By 2025, more than 100,000 men in the United States will face this challenging diagnosis. An alarming number that resonates as a call to action for us all. The prostate, a walnut-sized gland located beneath the male bladder, plays a crucial role in reproduction. Producing around 30% of the semen volume, it nourishes and protects sperm, being vital for fertility. However, this small gland can become the epicenter of a battle for life. The National Institutes of Health reveals a disturbing statistic: 1 in 8 men will be diagnosed with prostate cancer in his lifetime. If you are watching this video, you have already taken the first step towards prevention. Your health is important, and every action counts. Continue with us on this journey of knowledge and awareness. Prostate cancer does not discriminate, but some factors significantly increase the risk. Age is the most prominent risk factor, with incidence increasing dramatically after age 50. Epidemiological studies, such as the one published in the Journal of Clinical Oncology, demonstrate that African American men have a 76% higher risk of developing prostate cancer compared to white men. This racial disparity remains a topic of intense research and concern in the medical community. Genetics also plays a crucial role. Men with a family history of prostate cancer have their risk more than doubled. The BRCA1 and BRCA2 genes, famous for their association with breast and ovarian cancer, also increase the risk of prostate cancer. However, it is important to note that having risk factors does not mean an inevitable diagnosis. Surveillance and early detection are the best weapons against this disease. The first signs of prostate cancer are often subtle, easily confused with the natural discomforts of aging. This is where the danger lies. Complacency can cost lives. One of the first signs to look out for is the presence of blood in the urine, a symptom known as hematuria. Although it can be caused by other conditions, such as urinary tract infections, persistent hematuria should always be investigated. Difficulty urinating is another crucial early sign. As the tumor grows, it can press on the urethra, making urine flow difficult. This may manifest as a weak or stopped flow, or the feeling that the bladder is not completely empty after urinating. In some cases, men may find that they can no longer urinate standing up comfortably. This seemingly insignificant change could be an important indicator of prostate problems. Urinary frequency, especially at night, nocturia, is another sign that should not be ignored. Although it is common for older men to urinate more frequently, a sudden or significant increase in nighttime frequency warrants medical attention. It is crucial to remember that these symptoms, although concerning, are not a definitive diagnosis. Many men with these symptoms do not have cancer, and many with prostate cancer do not have symptoms initially. The key is vigilance and regular consultation with a healthcare professional. As prostate cancer progresses, symptoms can become more pronounced and diverse. It is crucial to be aware of these subtle changes in the body, as they can be the key to early diagnosis and successful treatment. An often overlooked symptom is pain or discomfort during ejaculation. This sign, often mistakenly attributed to other conditions, may indicate a significant change in the prostate. A study published in the Journal of Sexual Medicine revealed that up to 16% of men with prostate cancer report pain during ejaculation. The presence of blood in the semen, known as hematospermia, is another alarming sign. Although it can be caused by benign conditions, the persistence of this symptom warrants immediate medical attention. Research in the International Journal of STD and AIDS showed that 14% of cases of persistent hematospermia were associated with prostate cancer. Erectile dysfunction, often seen as a natural consequence of aging, can be an early indicator of prostate cancer. A study published in BJU International found that men with erectile dysfunction have a 59% increased risk of developing prostate cancer within the next 7 years. Chronic fatigue, an often underestimated symptom, may be a silent sign of advanced prostate cancer. This is not ordinary fatigue, but a deep and persistent tiredness that does not improve with rest. Cancer-related fatigue is recognized by the American Society of Clinical Oncology as a significant symptom that affects patients' quality of life. Unexplained weight loss is another sign that should not be ignored. When prostate cancer reaches advanced stages, it can affect the body's metabolism, leading to significant weight loss without changes in diet or exercise. A study in the Journal of Cachexia, Sarcopenia and Muscle showed that involuntary weight loss is associated with a worse prognosis in prostate cancer patients. Bone pain, especially in the spine, hips, or ribs, may indicate bone metastasis from prostate cancer. This pain is usually persistent and tends to get worse at night or when the body is at rest. The American Cancer Society reports that about 80% of metastatic prostate cancer cases affect the bones. Swelling in the legs or feet may occur if prostate cancer is pressing on the lymphatic vessels in the pelvic region. This symptom, known as lymphedema, can be an indicator of advanced disease and requires immediate medical evaluation. Changes in bowel function, such as constipation or difficulty having a bowel movement, may occur if the tumor is pressing on the rectum. Although less common, this symptom should not be ignored, especially if it persists or is associated with other signs. Anemia, characterized by low levels of red blood cells, may be an indirect sign of advanced prostate cancer. A study published in Cancer showed that anemia is associated with a worse prognosis in patients with metastatic prostate cancer. Importantly, many of these symptoms can be caused by benign conditions. However, the persistence or combination of these signs warrants a thorough medical evaluation. Early diagnosis of prostate cancer can significantly increase the chances of successful treatment. According to the American Cancer Society, the 5-year survival rate for localized prostate cancer is nearly 100%. Screening methods for prostate cancer include digital rectal examination and PSA, prostate-specific antigen, testing. Although controversial, these tests can provide valuable information when interpreted correctly by a healthcare professional. The PSA test, in particular, has been the subject of debate in the medical community. While some argue that it leads to overdiagnosis, others argue for its role in early detection. A study in the New England Journal of Medicine showed that PSA screening reduced prostate cancer mortality by 20%. It is crucial that men discuss the pros and cons of screening with their doctors, considering their personal and family history as well as their individual preferences. The decision to perform screening tests should be an informed and shared decision. In addition to physical symptoms, prostate cancer can have a significant impact on patients' mental and emotional health. A study published in the Journal of Clinical Oncology revealed that up to 27% of men with prostate cancer experience clinically significant depression. Anxiety is also common among prostate cancer patients. Fear of the unknown, worries about treatment and uncertainty about the future can lead to high levels of stress. The Prostate Cancer Foundation emphasizes the importance of psychological support as an integral part of treatment. The side effects of prostate cancer treatments can be challenging. Urinary incontinence, for example, affects up to 50% of men after radical prostatectomy, according to a study in European Urology. This side effect can have a significant impact on quality of life. Sexual dysfunction is another common side effect of treatments. A study in the Journal of Sexual Medicine showed that up to 75% of men experience erectile dysfunction after treatment for prostate cancer. It is crucial that patients openly discuss these concerns with their doctors. The impact of prostate cancer is not limited to the patient. Partners and family members are also affected. A study in psycho-oncology revealed that partners of men with prostate cancer often experience elevated levels of anxiety and depression. Open and honest communication within the family is essential to facing the challenges of prostate cancer. Support groups and counseling can be valuable resources for patients and their loved ones during this difficult journey. Despite the challenges, it is important to remember that prostate cancer is one of the most treatable forms of cancer when detected early. The 5-year survival rate for localized prostate cancer is nearly 100%, according to the American Cancer Society. Advances in technology and research are constantly improving treatment options for prostate cancer. Robotic surgery, for example, has shown promising results in terms of precision and patient recovery. Immunotherapy, an approach that uses the body's own immune system to fight cancer, is emerging as a promising option for some cases of advanced prostate cancer. A study in the New England Journal of Medicine showed encouraging results with the use of immunotherapy in metastatic prostate cancer. Focal therapy, which aims to treat just the affected area of the prostate, is gaining attention as a less invasive option for selected cases. This approach can help minimize side effects associated with more aggressive treatments. Active surveillance is an increasingly accepted management strategy for low-risk prostate cancers. This approach involves regular monitoring rather than immediate treatment, avoiding the side effects of treatment in men whose cancer may never progress significantly. Diet and lifestyle play an important role in preventing and managing prostate cancer. Studies have shown that a diet rich in fruits, vegetables, and whole grains, and low in saturated fats, can help reduce the risk of prostate cancer. Regular exercise has also been linked to a lower risk of aggressive prostate cancer. A study published in the Journal of Clinical Oncology showed that men who exercised vigorously for at least 3 hours a week had a 61% lower risk of dying from prostate cancer. The role of supplementation in preventing prostate cancer has been the subject of much research. Although some early studies suggested benefits from supplements like selenium and vitamin E, more recent research has not found convincing evidence of their protective effect. Awareness and education continue to be powerful tools in the fight against prostate cancer. Campaigns like Movember have played a crucial role in raising global awareness about men's health, including prostate cancer. The exact causes of prostate cancer are not yet fully understood, but scientific research has identified several important risk factors. Understanding these factors can help with prevention and early detection of this disease. Age is the most significant risk factor for prostate cancer. According to the National Cancer Institute, the risk of developing prostate cancer increases dramatically after age 50. About 60% of cases are diagnosed in men aged 65 and over. Genetics plays a crucial role in the development of prostate cancer. A study published in the New England Journal of Medicine revealed that men with a first-degree relative, father or brother, with prostate cancer have a 2 to 3 times greater risk of developing the disease. Certain genetic mutations, such as those in the BRCA1 and BRCA2 genes, are associated with an increased risk of prostate cancer. A study in the Journal of Clinical Oncology showed that men with BRCA2 mutations have an up to 8.6 times greater risk of developing aggressive prostate cancer. Race is another significant risk factor. African American men have the highest rates of prostate cancer in the world. Research published in Cancer suggests that genetic, environmental, and socioeconomic factors may contribute to this racial disparity. Diet and lifestyle also influence the risk of prostate cancer. A study in the American Journal of Clinical Nutrition indicated that a diet high in saturated fats and red meat may increase risk, while a diet rich in fruits, vegetables, and fish may have a protective effect. Obesity has been linked to an increased risk of aggressive prostate cancer. A meta-analysis published in BMC Medicine showed that obese men have a 20% higher risk of developing advanced prostate cancer compared to men of normal weight. A sedentary lifestyle is also a risk factor. A study in European urology revealed that men who spend more than 5 hours a day sitting have a 34% higher risk of advanced prostate cancer compared to those who spend less than 3 hours sitting. Exposure to certain environmental chemicals, such as pesticides and herbicides, has been linked to an increased risk of prostate cancer. A study in Environmental Health Perspectives found an association between occupational exposure to pesticides and an increased risk of prostate cancer. The role of chronic inflammation in the development of prostate cancer has been the subject of intense research. Studies published in Cancer Research suggest that chronic inflammation of the prostate may create an environment ripe for the development of cancer cells. Vitamin D deficiency has been linked to an increased risk of prostate cancer. A study in Clinical Cancer Research showed that men with the lowest vitamin D levels had a 3.5 times higher risk of aggressive prostate cancer. The role of androgens, particularly testosterone, in the development of prostate cancer is complex. While high testosterone levels don't necessarily increase your risk, they can accelerate the growth of existing cancer cells. Vasectomy was previously considered a possible risk factor, but more recent studies, including a meta-analysis published in JAMA Internal Medicine, did not find a significant association between vasectomy and prostate cancer risk. Smoking, although not a direct risk factor for the development of prostate cancer, is associated with an increased risk of aggressive prostate cancer and mortality. A study in JAMA Internal Medicine showed that smokers have a 24% increased risk of dying from prostate cancer. Exposure to cadmium, a heavy metal found in batteries and paint, has been linked to an increased risk of prostate cancer. A study in occupational and environmental medicine found an increased risk in workers exposed to high levels of cadmium. Despite the identified risk factors, it is important to remember that prostate cancer can be prevented and, when detected early, successfully treated. Prevention and early detection are the keys to combating this disease. A balanced diet is essential in preventing prostate cancer. Studies published in the Journal of the National Cancer Institute suggest that a diet rich in fruits, vegetables, and whole grains may reduce the risk of prostate cancer by up to 15%. Consuming foods rich in lycopene, such as tomatoes, watermelons, and papaya, has been linked to a lower risk of prostate cancer. A meta-analysis published in Cancer Epidemiology, Biomarkers and Prevention showed a 9% reduction in risk for every 10 milligrams of lycopene consumed daily. Regular physical activity not only reduces the risk of prostate cancer, but also improves outcomes for those already diagnosed. A study in European urology revealed that men who exercise regularly have a 51% lower risk of dying from prostate cancer. Maintaining a healthy weight is crucial. Obesity not only increases the risk of prostate cancer, but also makes diagnosis and treatment difficult. Losing weight, even moderately, can significantly reduce your risk. Moderate coffee consumption has been linked to a lower risk of aggressive prostate cancer. A study published in BMJ Open showed that men who drink 3 or more cups of coffee a day have a 53% lower risk of high-grade prostate cancer. Vitamin D supplementation may be beneficial, especially for men with low levels. However, it is important to consult a doctor before starting any supplement regimen. Excessive alcohol consumption should be avoided. Although moderate drinking does not appear to increase risk, heavy alcohol consumption has been linked to an increased risk of aggressive prostate cancer. Quitting smoking not only reduces the risk of aggressive prostate cancer, but also improves overall health. It's never too late to quit smoking, and the benefits begin immediately after cessation. Regular screening is crucial for early detection. Current American Cancer Society guidelines recommend that men discuss prostate cancer screening with their doctors starting at age 50 or earlier if there are additional risk factors. Digital rectal examination, although uncomfortable for some, remains an important tool in early detection. Combined with PSA testing, it can provide valuable information about prostate health. New diagnostic technologies, such as multi-parametric MRI and fusion-guided biopsy, are improving diagnostic accuracy and reducing the need for unnecessary biopsies. For those diagnosed with prostate cancer, it is important to remember that not all cancers require immediate treatment. Active surveillance is a viable option for low-risk cancers, allowing patients to avoid treatment side effects while closely monitoring disease progression. Psychological support is crucial for both patients and their families. Support groups and counseling can help deal with the stress and anxiety associated with prostate cancer diagnosis and treatment. Finally, it is important to remember that knowledge is power. Being informed about prostate cancer risk factors, symptoms, and prevention options can save lives. Don't hesitate to discuss your concerns with a healthcare professional, and encourage the men in your life to do the same.